An intern on duty experienced a needlestick injury, unfortunately. The intern has completed his hepatitis B vaccination series already, but his antibody status against hepatitis B virus is not known. The source patient has unknown bloodborne infection status, and the source patient is an IV drug abuser, homeless, and already left the clinic. So, what is the most appropriate next step to do now? The scenario I am going once again. A doctor intern unfortunately have a needlestick injury doing work in the ward. The intern has the history of completion of hepatitis B virus vaccination, but the antibody status is not known. And with whom he has the accident, that source patient has unknown bloodborne infection status, and that patient, source patient, IV drug abuser, homeless, and already left the clinic. So, what should we do now? Okay. Option A, inform the police to locate the patient. Wait until the patient return to check their status. We can wait for the patient. Give the intern hepatitis B vaccine booster. This is booster. We can give booster. Start the intern with post-exposure prophylaxis for hepatitis HIV, most important one, and hepatitis C, another important virus. Post-exposure prophylaxis. And lastly, immediately check the intern B virus level, that is anti-HBs antibody level. So this is a tricky question, and the options are more tricky, especially the last two, as because the source patient is an IV drug abuser and homeless. So we are not sure, but that source patient may be a source for hepatitis B virus, hepatitis C virus, HIV, and so on. Our intern doctor has the hepatitis B virus vaccination, but the anti-HBs antibody level not known. So what can we do? We can do immediately to assess the serum level of B virus, IgG, IgM, or IgG, total immunoglobulin level against hepatitis B. Or we can go for immediately post-exposure prophylaxis, that is called post-exposure PEP, post-exposure prophylaxis for HIV, and post-exposure prophylaxis for hepatitis C virus. Most important thing. But unfortunately we know there is a provision for post-exposure prophylaxis for HIV, we know better, but there is no provision, no recommendation for post-exposure prophylaxis of HCV. So though the post-exposure prophylaxis for HIV, this option is correct, but the post-exposure prophylaxis for hepatitis C, this option is not correct. So better we can go for this option E, immediately check intern HBs, anti-HBs antibody level. So this is the answer of this question. we can go for checking anti-HBs antibody level. And when we have the report of anti-HBs antibody level, then what can we do? The first step after a needlestick injury is to assess the intern's immunity by checking his anti-HBs level. If the anti-HBs level is more than 10 unit, mind it, he is protected and no further action is needed for B virus. But if the anti-HBs antibody level is less than 10, the patient need hepatitis B immunoglobulin plus booster vaccine. That means active plus passive. Okay. If the anti-HBs antibody level less than 10 unit. Now regarding HIV and hepatitis C, what already I mentioned, that since the patient is a high risk, that is the source patient is a high risk, and HIV HCV status is not known, sorry, start HIV PEP immediately while awaiting for information. That means we can start the PEP for HIV, but hepatitis C PEP is not available and it is not recommended. But regular monitoring for HCV infection is recommended. So as a whole, we cannot go for the option D, rather we can go for option B. So this is a very important and tricky question for any exam related purpose. So thank you very much.